Good afternoon, everyone, and thanks for joining Research to Reality at the National Cancer Institute and our partner, the George Washington University Cancer Center, for a short coffee break webinar. Our speaker today will present on supporting cancer survivors through comprehensive cancer control programs, a report that presents a snapshot of the state of cancer survivorship in the U.S. and can help guide comprehensive cancer coalitions and their support of cancer survivors and caregivers. The format for our coffee break will be a 20-minute presentation followed by 10 minutes for discussion. This is a slightly new format for us, so please take a few minutes after the webinar to complete the evaluation and let us know what you think. One more note on logistics. All questions will be answered during the discussion in the last 10 minutes of the webinar, but feel free to ask questions at any time during the presentation through the chat and Q&A boxes. All participants have been muted upon entry, but you will be unmuted for the Q&A portion of our coffee break if you would like to join the discussion live. Please mute your phones when not actively speaking in order to reduce background noise. Please do not put your phones on hold, as that may disturb the session with hold music or your organization's hold recording. Finally, we will send out a follow-up email with the recording, presentation, and any other additional resources after the webinar. So now I am pleased to introduce our speaker, Allison Harvey. As Senior Manager of Healthcare Professional Education at the Institute for Patient-Centered Initiatives and Health Equity at the George Washington Cancer Center, Allison manages the planning, development, and implementation of the Institute's provider and cancer control professional education. Allison holds a Master's of Public Health degree from GW and is a Certified Health Education Specialist. Prior to joining GW Cancer Center, she oversaw the development and dissemination of cancer patient and caregiver education programs at the cancer support community. So without further ado, Allison, the floor is yours.
Great. Thank you so much, Jordan, and good afternoon, everyone. Thank you so much for joining us for this kind of new format, this coffee break format. And also my apologies, I do have a bit of a cold, so hopefully you can understand me and hear me okay, and look forward to a discussion at the end of the call. So just to really briefly acknowledge, we'd like to acknowledge the Centers for Disease Control for their support of this report and this work, but the information discussed here does not necessarily represent the official views of the CDC. And the learning objectives for this coffee break are to recognize current health status of cancer survivors and disparities in post-treatment cancer survivorship, as well as identify the role of comprehensive cancer control programs in supporting post-treatment cancer survivors and caregivers. And so what is the role of comprehensive cancer control in post-treatment cancer survivorship? So it has been identified as a priority area for comprehensive cancer control coalitions, and we do foresee, in the coming years that this will, potentially remain a priority area for Comp Cancer. And so to support the work of Comp Cancer, the GW Cancer Center released this report. You can download the full report at this link. In September to really help guide as you think about your state cancer plan or planning activities in relation to survivorship. And so this resource really provides an introductory kind of overview of post-treatment cancer survivorship needs, and also offers potential benchmarks that could be used to include, again, in your state cancer plans, and also identifies potential system-level opportunities for supporting cancer survivors and caregivers. And so how are the benchmarks, and how are they developed? So the benchmarks align with the domains outlined in a National Action Plan for Cancer Survivorship, a report released by the CDC and Livestrong in 2004. And the domains are surveillance and applied research, communication, education, and training, programs, policies, and infrastructure, access to quality care and services. And the benchmarks underneath these domains were developed based on the available evidence, conversations with professionals in the field, and informed by recommendations from other reports, standards, and resources. And so now let's actually kind of take a look at the report itself. And so I'm going to share my screen. Give me a few minutes. All right. So now you should be able to see the report, and we'll kind of walk through first the table of contents just to kind of provide a bit of an overview, and then go into more of a focus on the benchmarks. And so really, again, I'd like to first kind of highlight kind of the table of contents here. So really you can kind of see that the first half of the report really focuses on an overview, but then the second half is really focused on potential benchmarks along with potential, other measures that you could use in developing your cancer plan or activities, as well as resources to help you achieve those benchmarks. And so as just a reminder, so kind of as far as the available data and limitations go, most of the data available does not necessarily always focus on specifically post-treatment cancer survivorship needs. So for example, questions that are included in BIRFIS or other data sets may more broadly ask about, have you ever been diagnosed with cancer, but may not specifically focus on, where that person is in their current kind of disease trajectory. So that's something to kind of keep in mind. And then as far as kind of the health status and needs of cancer survivors, first we'd like to kind of do a quick poll question and see how many of you currently on the call, if you can just answer the poll, how many of you currently address any of these kinds of health status and needs in your current cancer plan? So we'll open up the poll and wait just a few seconds and just kind of see what the responses are, and then we'll move forward from there. Okay, great. Well, while you all finish kind of addressing the poll or filling out the poll, it looks like a number of your cancer plans either address cancer screening, surveillance, and or follow-up care, tobacco use, as well as a number of you have plans that specifically address healthy weight, physical activity, and a little less around psychosocial or financial impact. So that's great, as these are really, a number of kind of high need areas for post-treatment cancer survivors. So in regard to cancer screening, surveillance, and follow-up care, some studies found survivors to be less adherent to screening or no different compared to non-survivors, while other studies found survivors to be more adherent. As for surveillance, socioeconomic status, for people who had low socioeconomic status, they did not receive the same follow-up care compared to survivors with a higher socioeconomic status. For tobacco use can vary among survivors. However, national data indicates that a higher percentage of survivors may smoke compared to non-survivors. Providers have also cited barriers to encouraging tobacco cessation among cancer survivors. For healthy weight and physical activity, approximately a third of survivors are obese and do not get the recommended amount of physical activity. For psychosocial concerns, cancer survivors typically report higher levels of depression and anxiety compared to the general population. And then for financial impact, there are a number of different things that can impact people financially, but survivors who reported financial problems were significantly more likely to delay medical care. So this, again, the report just kind of provides a brief snapshot of these areas, and then we move into the systems-level approaches to address the needs for post-treatment cancer survivors. And there we provide kind of an overview of survivorship care plans, kind of the current status of where we are at a national level, as well as recent kind of guidelines that have been released to help providers address the needs of post-treatment cancer survivors that are highlighted in the above section. And then we move into disparities in post-treatment cancer survivorship. Again, the report does highlight different areas where there are disparities, but then we kind of take a closer look kind of at disparities by different groups. And so again, just to briefly highlight, racial and ethnic minority survivors are more likely to experience a number of barriers and challenges, including lack of culturally and linguistically appropriate resources, report lower quality of life, and not receive the same recommended follow-up care and surveillance, to name a few. For people who identify as lesbian, gay, bisexual, transgender, or queer, we know currently that there really is a dearth of data as far as incidence and prevalence of cancer among this group, and there's even less so about post-treatment cancer survivors who identify as LGBTQ. However, it is important to point out that one study did find that gay male cancer survivors were more likely to experience psychological distress and consume more alcohol compared to their heterosexual male survivor counterparts. And then for rural populations, rural cancer survivors are more likely to smoke, be less physically active, have health-related unemployment, and report poor physical and mental health. And they also may be less likely to receive follow-up care recommendations and also forego medical care. And so I think it's also important to point out, while we discuss kind of these groups in categories, that these groups can and do intersect, and so something to keep in mind as you work with your different communities and your different populations in your state, tribe, or territory, that these groups are not, excuse me, mutually exclusive. And so for adolescent young adults, these survivors also have many unique and overlooked needs, such as issues with infertility, increased risk for developing second primary cancer compared to those who receive a cancer diagnosis later on in life. They also face a number of health-related issues related to cancer treatment early on, because of cancer treatment early on, such as damage to the heart and other medical conditions. And they also are more likely to engage in risky behavior and also report higher economic burden as well as lack of insurance. And so I'm actually going to pause here before we go into the benchmarks for the and discuss kind of the benchmark domains. We'll open up another poll. And so how many of you currently have a survivorship committee or work group? So we'll take a few minutes. Does your coalition, or I'm sorry, are you a member of your coalition survivorship committee or work group, and or do you not have a survivorship committee or work group? So we'll pause here for that. Okay, so it looks like about a little over half of you are currently a member, and about 12% indicate that your coalition does not have a survivorship work group or committee, and 6% you're not sure. So we'll address kind of that, kind of how to find out, or if you don't have one, some things that you can do to potentially establish one later on in the Q&A. So now we're going to go into the benchmarks And so, again, these are going to fall under the domains. So we'll first start with surveillance and applied research. And I've highlighted a few of the benchmarks here that we can discuss. And then, again, you can always refer to the report for more, in-depth review on your own. So the first benchmark is to increase the use of cancer survivorship, sexual orientation and gender identity, anxiety and depression, and caregiver modules concurrently in BRFIS. And so the potential measures that you could look at are number of modules offered, number of years offered, number of post-treatment cancer survivors participating in the modules. And so really kind of why this is important is that there is really, again, a lack of data on the needs of post-treatment cancer survivors as well as those who are their caregivers. So really having a better sense at a national and state level of what's going on with post-treatment cancer survivors is really important so we can better identify what the needs are, what the current health status is, and then appropriately develop interventions or policies to address those needs. The next benchmark is to assess current tobacco cessation efforts and potential barriers among healthcare practices that treat or care for cancer survivors. So I hope during the Q&A, for those of you that indicated that your state cancer plan currently addresses tobacco use among cancer survivors, I hope you'll kind of be able to speak up and share your experience about what you're doing within your coalition or work group. We would be interested to hear. But again, tobacco cessation, there's a huge need, and really understanding what is going on at that level and having a better sense of what's taking place to really then be able to appropriately develop interventions or target existing materials to survivors, as well as educating providers. And then we'll move into communication, education, and training. The benchmark that I'd like to highlight here is promote education and training opportunities to healthcare providers with a focus on primary care providers to increase awareness of survivorship care guidelines and survivorship care. So as we know, we have a number of cancer survivors, and this number will continue to increase over the next 20 years. And so it's really important that all providers are equipped to be able to handle the specific and unique needs of post-treatment cancer survivors. And so really helping providers understand what the current best practices and guidelines are as in relation to, care management, screening, and other areas. And so helping them feel equipped to be really managing the influx of survivors that they will see in their practices. A few other benchmarks are promote existing evidence-based and nationally recommended educational resources to cancer survivors and caregivers to help address follow-up care, lifestyle, psychosocial, and financial concerns. And so again, in the resources section at the end of the report, which I'll go over briefly, provides a number of resources for cancer survivors, and these organizations offer a number of wonderful resources. And so again, trying not to duplicate efforts, but pointing people to existing resources, but then also understanding that there are gaps and there may be specific needs within your own communities, and so developing educational resources where needed. And so maybe there aren't as many culturally or linguistically appropriate resources out there for a certain subset, and so looking at developing materials as needed. And again, just to highlight that these benchmarks also have potential measures that you could use, again, thinking about, kind of distribution, measuring, your number of times that, an email was distributed, what the open rate was, number of resources developed, and thinking of those kinds of things as you think about your cancer plan. And then moving into programs, policies, and infrastructure. So assessing current comp cancer survivorship activities. So again, while it wasn't a potential measure, again, these are just to kind of guide your thinking, but a potential measure here could be, you just even assessing if you have a work group. So if you don't have a work group, considering what that would look like if you were to develop a survivorship work group, and a few other things that you could look at as part of comp cancer activities. And then another measure under programs, policies, and infrastructure is the development of a community health worker or patient navigator network if one does not exist. Several states already do have these networks in place, and if you don't have one, these networks can really be a wonderful opportunity to disseminate information to people who are really working with post-treatment cancer survivors and their caregivers on a more regular basis. And again, being able to disseminate information around screening, surveillance, and helping, which we'll discuss in a little bit, but helping connect people to follow-up care and appropriate surveillance as well. And then one of the last ones in relation to policy is assessing current fair employment laws and regulations for people diagnosed with cancer at the state, territory, and municipal levels. And so again, cancer survivors can face a number of employment issues and experience discrimination based on their cancer diagnosis. Some states do have laws in place that address this. So really, again, taking a look at where there may be opportunity to educate lawmakers at the local or state level as far as, what could be put into place to help ease the burden of a cancer diagnosis and ensure that no one is discriminated against based on their disease status. And then, and then finally, actually under this level, I would like to point out is really supporting local health departments and implementing survivorship activities into their programs. And so, again, here's really just an opportunity to, again, disseminate information at a more local level. So, for example, if a local health department was going to be doing a screening program, maybe thinking about a bend of doing a screening program for post-treatment cancer survivors. So really looking at ways to incorporate post-treatment cancer survivors in activities across the continuum. And then finally, access to quality care and services. Again, here is two benchmarks, and really could be looking at supporting linkages to follow-up care for cancer survivors, as well as supporting linkages to cancer screening services for cancer survivors. And you can see, even how those these linkages could tie into other areas, but again, really looking from the lens of working with patient navigators and community health workers to help make those links. And finally, for the resources section, we have, again, the resources are have little icons by them as to what domain they apply. So surveillance and applied research, communication, education, and training, programs, policies, and infrastructure, and access to quality care and services. And so the resources section, we hyperlink to resources, and then, you can see here which domain it applies to. Some have, have resources that apply to more than one domain. So again, you can go to the report and then link out to the resource directly. So with that, I will actually open it up. Well, actually first, we're going to pause here, so we're going to move into the Q&A portion. But for those of you that don't want to stay on for the Q&A discussion, which will last approximately 10 minutes, we would ask you to go ahead and complete this brief evaluation in the poll that will pop up for the coffee break webinar. So this is a little bit of a new format that we're trying. So if you're going to hop off, we do ask that you go ahead and complete the poll before you do, but if you're going to stay on, feel free to stay on and complete it at the end. So now we will open it up for Q&A.
My name is Mohammed. I'm the Senior Manager for the Comprehensive Cancer Control here at GW. Before we start with the Q&A, I wanted to quickly follow up on the polling question results. For those of you who indicated not knowing about having a survivorship work group in your coalition or not having one at all, you can talk to your steering committee about starting one. A lot of the groups have a palliative, or the coalitions have a palliative care work group or focus. Those are obviously two different focus areas, but many of the people in the palliative care group may have experience in post-treatment survivorship or survivorship in general, since the definition is technically at the time of diagnosis. So depending on what your interests are, some of the experts will be in the palliative care group. That's a place to start as far as recruiting members and experts. A lot of states have started out having combined the two groups. So when they initially created their plans, most states have been, as they update their plans, have been separating these groups because we do need to have different focus areas along the continuum, and survivorship is its own area. But if your state has not done that when updating your comprehensive cancer control plan, this would be another place to start thinking about membership recruitment for survivorship and creating the group. For the other question, talking about survivorship needs, also as you update your plan, you can think about adding a needs assessment for survivors at the state level as one of your objectives in your plan. If your state has not done that already, you'll find out, that you'll be able to highlight disparities, you'll be able to highlight priority areas, especially around mental health, psychosocial needs, and financial needs. For those of you who have not done much on specifics for survivors on tobacco cessation, physical activity, and nutrition, you can also talk to the prevention work group or the early detection work group. Any of the groups in the overall coalition that have developed objectives around those areas to at least start defining some of your objectives for survivors, and then thinking about evidence-based strategies and interventions that are tailored specifically to survivors. But that is another place to start. It looks like we don't have any additional questions in the chat so far that we have not addressed. If you have any, feel free to send them there in case we run out of time. We can always know that there's a question that we can address later. But in the meantime, if you would like to say anything now before, while we have some time left, please feel free to just introduce yourself and let us know what your question is. And we'll make sure that you're unmuted in a second. In the meantime, while we wait for you to formulate questions, and again, if for any reason you're muted and we didn't hear you, feel free to put your question in the chat. I wanted to see if Lexi from South Dakota is on. We had talked about just taking a couple of minutes to briefly share experiences or highlights on South Dakota's experience partnering with cancer treatment centers to disseminate survivorship care plans. Lexi, if you're on, feel free to, the floor is yours.
Hello, this is Lexi. Are you able to hear me?
Yes, thank you.
In South Dakota, we were recipients of the Cancer Survivorship Cooperative Agreement from CDC, and so we did expand upon the current partnerships we had through our Comprehensive Cancer Control Program to partner with 5 of our cancer treatment centers. And through that partnership, we've really expanded their capacity to implement survivorship care plans. We worked through the process of early identification of patients, working with their cancer registry to identify all eligible patients, integrating workflows into their EHR, and then data tracking elements to actually capture and track the services that they're providing. We also developed a patient navigation network and expanded the navigation services that are provided in the partner cancer treatment centers as part of that survivorship care visit to really focus on tobacco use and tobacco cessation, nutrition and physical activity assessment and referral, preventative cancer screening and psychosocial support and needs, And then we've also expanded our surveillance opportunities. We've integrated that cancer survivorship module that was referenced into 2 of our BRFSSs within the state, and we're developing surveillance reports based on that information. And then we've also expanded a lot of our professional development opportunities, looking at treatment recommendations and guidelines for post-treatment cancer survivors, and then also looking to expand resources that are provided to cancer survivors. And we did publish a white paper on kind of the facilitators and barriers to survivorship care plan implementation within the state, and that can be found on our Cancer Coalition homepage, cancersd.com, if people are interested, or feel free to reach out to me if you have any questions or follow-up on the work that we've done here in South Dakota.
Great. Thank you, Lexi. And actually, one quick question, and you may be able to answer, I mean, particularly with survivorship care plans. So as part of survivorship care plans, there is, a need to include a list of resources for survivors. Do you have any insight into how those resources were identified at a local or state level for cancer survivors in South Dakota, how you all went about that?
Yeah, we, with South Dakota being a fairly small state, a lot of the public health officials that work in cancer have longstanding history of working collaboratively. So we did assessments. We do just have 7 cancer treatment centers within the state to do an assessment of the resources that were available in those particular areas, and then also did a lot of work doing assessment around those referral sources for like nutrition, physical activity programs, and some of those auxiliary services, especially around like anxiety, fear of recurrence, some of those things. And so it's just kind of on an individual level with the community resources around the different cancer treatment centers that we were working with, and then as well as support from statewide partners such as the American Cancer Society and the Commission on Cancer, and then also inclusion of national partners and resources as appropriate.
Great. Thank you.
So we're coming up on our time, but I wanted to address quickly a question that we received in the chat. May not be able to send suggestions now, but I'm happy to share those later, and maybe a few other people who have succeeded in doing this. Basically, the question asks if there are suggestions on how best to identify and compile then disseminate local survivorship resources to providers or survivors. So as far as putting resources together, typically Cancer Coalition work groups meet or should be meeting fairly regularly to talk about, to implement their plan and kind of figure out, status and delegate the work amongst the members and their organizations who might be able to do some of that work. And if those are usually, a lot of times they're just monthly phone calls. If occasionally the work groups would meet in person and create a database for resources, if you get a work group, all work group members in one room, and they're typically, at least geographically, diverse as far as where they are in the state, or they come from different organizations, whether it's state, whether it's nonprofits, whether it's hospitals, direct practice, these people will be able to, put it together, a database. When I was in Georgia, that's kind of what we did. We ended up, we did an assessment on Georgia survivor needs, and then started thinking about the resources to address those needs. And we got in one room, and we had a pretty good comprehensive list of what resources are available that address certain needs. So, as far as dissemination, that could also be, it's a, bit of a, it could be a challenge, but this could also be done through publications and through conferences, like regional conferences, as well as one way to kind of make it known. It could also be published as far as the, with the state plan, depending on how it's if your state would allow for, adding those kind of amendments, nonprofits or other leading groups in those coalitions might also have websites where they're focusing specifically on survivorship needs. So it could be a collaborative effort and then posted on that website, and then kind of continuing to promote that website through the different social media outlets and other dissemination efforts that are already happening. I mean, the idea is not to reinvent the wheel and continue to tag on efforts that are happening already in your state through the coalition membership, and so you're just kind of developing a resource and then using those efforts to disseminate it. I think we're close to the end of our time. We will definitely follow up with the rest of the questions that have been posted on the chat. But for me personally, I'd like to thank everyone for being on, and I appreciate the really valuable questions. And Lexi, also thank you for sharing your experiences with South Dakota.
Great. Thank you so much, everyone. We appreciate you participating in this coffee break, and thank you again to Research to Reality for partnering with us to deliver this webinar, and we hope that you enjoy the rest of your day.
Thank you.